welcome to another episode of Rethink Healthcare. I'm Wendy Ball, and this is
Paul Montenegro.
The crowd goes wild. What are we talking about today?
Prioritizing.
Prioritizing, yeah.
You know what I always prioritize first?
Food.
Yeah. Oh my God.
I know it.
It is getting big.
Who doesn't like a good meal, you know?
I love a good meal.
Or a good gut, you know?
That's why I do marathons, so that way I can eat a lot.
Get your metabolism going, and then you can just eat whatever you want.
Have you done your exercise today?
I have not. Did you do yours?
No, I'm on rest today because I did a 16 miler 2 days ago, so it's a rest day today.
I was just on vacation. I've been hiking every day. So.
Oh, you know what?
So.
Hiking and walking, I think, are actually the best forms of exercise.
They are good. So prioritize
your
exercising.
Health. Yes.
Your health, eating well.
Yes. So as nurses, nursing students, yes, make sure you have to prioritize yourself first, because how can you possibly care for somebody else if you yourself are not well?
Yes. I love that, but I don't think that's quite what we're talking about.
No, that wasn't the point of this.
Right.
Anyway, let's get to the gist of what we're prioritizing. So, decision making, clinical decision making is what that is and what matters. So, I guess let's just run through. I mean, when somebody asks you, "Hey, what if you were to tell viewers what is the one thing you want to emphasize when it comes to prioritization?"
I mean, you got the old, ABC.
Okay.
Now.
ABC. Okay.
ABC.
Yeah, I mean
not
that's
D, E, F, G, H, I, J, K, L, M, N, O, P.
Yeah. Okay. I get that. In my mind, right? When I talk about when somebody tells me, okay, when you prioritize, when you look at your set of patients and you have to prioritize, I really keep it simple. Who's at risk of dying now?
That's a good one. Who's going to be dead first?
Yeah. I mean,
but do you know what? Prioritizing that's good in your work, but if there's a mass casualty, the ones that are going to die, we just let them go.
You just let them go. It's like, who has a chance of living?
Who has a chance of living?
Yes. No, that's true. I mean, that's your EMT background there. When you do incident command, and you have, let's say there's a train accident, and you have to choose, right? Who do you prioritize among these, right? 81-year-old with a fractured femur who is probably having a heart attack, or a baby who has some scratches and is crying for their mom, or the mom who got pinned underneath a piece of metal, so those are, I mean, you have to look at the age, the risk factors in mass casualty.
I actually had students when I taught that, they're like, you're going to let somebody die? And no, I mean, I don't want to let anybody die, but if there's one of me and 10 patients, I can only care for one person at a time. So unfortunately, that may be the problem.
So that's one scenario, right?
But that's like extreme. More like extreme.
But that's part of healthcare, right? So let's say that you're on the medical surgical unit or whatever, it doesn't matter, cardiac unit, whichever unit you are, right? And you're handed your set of, let's say, 6 patients, right? I mean, that's kind of at least for us, that was a norm number, right? I mean,
they might have 10 now.
Who knows? Depends on the skill mix.
Yeah.
So let's say you're handing your 6 patients, and I was always taught, once you get the report, you always kind of prioritize first, okay, who is at great risk here?
Yeah.
Who is the least stable? Then that's who you prioritize first.
And you're prioritizing at the beginning of your shift may change as you go into rooms or different things evolve with the patient. So we're constantly not only prioritizing, but reprioritizing our patients.
Of course, yeah. Not only that, right? But the team around you could influence who you prioritize with.
Absolutely.
So let's say that you're in a skill set where you have an LPN working with you. Let's say you're an RN, you have an LPN working with you, you have an aide working with you. Well, you could utilize the team to say, let me see this patient first. Can you see these other patients who are maybe a bit more stable?
Yes.
Right. So you could certainly delegate accordingly. Yeah. But you know what's interesting too when you talk about prioritization? because I work a lot with software and artificial intelligence, and there's also prioritization in artificial intelligence. Did you know that?
I'm sure there's prioritization.
Yeah.
Well, that's a mouthful. In everything, in our life, what we're going to do in the day. So I'm not surprised.
Yeah. I mean, so for example, right? Let's say the self-driving car now has is going to run into something. It's going to have to choose which one does it run into.
Does it run into the trash can or me?
Yeah.
I hope the trash can.
Or if there's multiple people there, right? It's going to be able to choose. So those are parts of. Just think of any.
The baby or the old person.
Who knows, right? But that's part of remember, artificial intelligence is programmed by humans.
I know. Yeah, it is a human still making that decision.
It's programmed in. It's a very complex set of algorithms. So, but for us as healthcare workers, right? I mean, I like the ABC analogy. So that's one way to prioritize in a mass casualty scenario, like you said. I mean, who is likely to survive, right? On the units, right? Who is let's say you get somebody who's just fresh out of the operating room, side exposed, versus somebody who's there for pneumonia, who's not really complaining of much. Who do you need to see first, right?
Yeah.
You got to see who is the most unstable person first. Is how I always thought about it. Does that make sense to you?
Yeah. And as we teach like Maslow's hierarchy, we have the little pyramid.
Yes.
We got to kind of think about that as we're doing things.
So how do we apply that, right, for Maslow's hierarchy? If somebody is asking for food versus somebody saying I can't breathe.
Well, they're still in the same bottom level, the physiologic level. So then we have to prioritize within that. But if somebody's asking you maybe to, I don't know, help them get dressed as opposed to, taking them to the bathroom.
So so when you say like the food and breathing are in the same level, that's when you go with your ABC. So you go into a second tier prioritization because the other one is not saying I can't breathe. They want to feed their gut, while the other one is going.
We're going back to this gut again.
I like my gut.
Yeah. I love when I was an ER nurse for, over 10 years, and my favorite spot in the emergency room was triage.
Triage, really?
Yeah, love triage. Love that. And again, there's priority there. If you've ever been to an emergency room and you think, why does that I've been sitting here for 2 hours and that patient just came in and they got to go right back. Here we are, right to prioritizing, triaging that patient. That patient, for some reason, is more urgent or emergent to be seen. So we have to follow that.
I thought they slipped you an envelope with a 20.
Yeah, well,
that's why they got it first.
It's actually chocolate, but
chocolate. Oh yeah, because we're not able to get bribed. But chocolate would always do.
Just leave a little brownie there or something.
Hey, can I get in first? Here's
So how do we get better at prioritizing?
That's a good question. Yeah. So we need to rethink this. How do we improve prioritization? I think one of the things is experience comes into a big account when it comes to honing in your prioritization skills.
Yeah, I think that is key. More experience.
So how do you then cut the experience level down to improve, let's say, somebody who's new in there? So obviously years of experience, there's no substitute for that, right? No. But then from the rethinking aspect of this, how do we, that's a good question. I mean, are there algorithms that you're aware of to prioritize who? Nothing that I'm aware of.
I mean, we have scenarios. I think thinking through things is good, because even when I talk to my students about communication, if we can think about something that could happen, maybe a patient, I don't know, reacting to you in a certain way. How are you going to respond? And if you think about that before it happens, you already have a way. So I think if we think about these situations, hey, I have these 5 patients. Why am I going to see this patient first? So I think just kind of educating ourselves, thinking about it, applying that maybe to even seeing another nurse with a group of patients and why they're going to see that patient first may be helpful.
Okay. One of the things I was kind of thinking of, and this is something that I've kind of used when I was programming the software for the learning, is looking at physiology.
Okay.
If you understand the physiology well and you base the complaint onto the physiology, so for example, right, a cardiac patient will be treated at a higher priority versus somebody who has a musculoskeletal injury, right? But if that musculoskeletal injury is like a crush injury, right, it could be more critical to the cardiac patient. Then you also have to look at the time factor too, right? So for example, if the crush injury has been there for a long time and the complaint of angina is still relatively new, right? So you would think, okay, maybe the angina is more important. But then the crush injury that's been there for a long time, then you have to actually think that crush injury could lead into a cardiac event because of the lysis of potassium. So then time comes into play too, but that's experience, but then I guess it's more scenario based. Yeah. The more you go through different scenarios and talk to your peers or talk to your mentors about, hey, in these cases, which one, because we're always all learning.
And sometimes we're surprised who we see first. Like there are some of those scenarios where we're like, ooh, I didn't realize this was so important to see this patient first. So we're going to prioritize our patients. We're going to prioritize our health. We're going to prioritize what food we're going to eat next. We're just going to wrap it all in, right? So,
anyway, but there's no one clear-cut answer. I mean, it's a combination of different events, combination of different factors, and all those are all really bound to change because the human body is a living organism, and it constantly changes in the matter of time that you're caring for them. So, anyway, is that it for our time?
That's it. So we'll prioritize, and we'll see you next time.